Hello, today I am going to talk about dementias and mainly I will be focusing on reversible causes of dementia. So, by the word dementia, what we mean is forgetfulness or memory loss along with impairment in other brain functions. And the impairments in the brain functions are so severe that the person is unable to handle their daily life activities, and then it is called as dementia. And then usually when we say dementia, the condition is supposed to be progressive and it gets worse over time. But today my focus is on reversible dementia. So not all dementias are Alzheimer's disease, which is the most common cause of dementia, where the person keeps on getting worse over time. But there are a group of disorders where once we identify the typical identifying the responsible cause and treat them on time, we can expect improvement. And they are called as reversible dementias. And approximately about 20 to 25% of all dementias that we see in our clinics could be reversible dementias. So it makes it important for us to look at them one by one. So in our country, vitamin B12 deficiency is one of the commonest causes of reversible dementias. B12 deficiency can occur in people who are strict vegetarians and also among non-vegetarians because of poor absorption of B12. And it's a simple blood test which can help us to diagnose. And once we diagnose and start on vitamin B12 injections, patients show very good improvement. Other one which is closely linked is thiamine deficiency, which is more common in people who abuse alcohol, and rarely it can be seen in pregnancy and after bariatric surgeries. But the commonest underlying cause can be alcohol abuse. So, in a person who is chronic alcoholic and abuse alcohol, we should think of thiamine deficiency. And again, with the help of history and with the help of typical MRI findings, we can diagnose. And supplements of thiamine can help us treat them. Next, we come to metabolic or endocrine disorders. In that, the commonest cause of dementia is hypothyroidism, where the thyroid hormone deficiency is there. And as a result, people have forgetfulness and memory impairment. And again, it's very easy to diagnose with the help of blood tests like thyroid stimulating hormone or TSH, and then few other tests. And once we replace thyroid hormones, we can expect good improvement. The next cause will be head injury. So if a person may have trivial head injury or sometimes it may not be obvious, but the blood can accumulate between brain and the skull bone, what is called as subdural hematoma. And a chronic subdural hematoma, which is for long time, can compress the brain and lead to memory impairment and dementias. A simple CT scan can help us diagnose and treatment of that. If we evacuate the hematoma, the person's can improve. Other condition that could require surgery and can cause dementia is the brain tumors. So, in a person who's slowly getting cognitive impairment or behavioral changes, along with mild headache, sometimes headache may not be there, or over a time the person is getting worse. Sometimes there could be weakness of one hand, one leg. So, we need to think of brain tumors, and again, a brain scan can help us diagnose. And after surgery, the patients do improve. And one more condition where surgery can help is something called as normal pressure hydrocephalus, where the CSF production is slightly more than normal and there is pressure exerted by the cerebrospinal fluid on the surrounding brain parenchyma, and that can lead to dementia. Along with that, people also have difficulty in walking short, shuffling steps. It could mimic like walking of Parkinson's disease patients, and they also have urinary disturbances. So, if you see a person who has a triad of dementia, urinary symptoms, and difficulty in walking, we should think of normal pressure hydrocephalus. And with the help of brain scan and something called as drainage LP, where we let out the CSF from the lower back, and the person's walking improves, that could be a sign that the person may improve with surgery. That is called as shunt surgery. So that's a surgical cause. The other group of disorders that can cause reversible dementias are neuro infections. So several infections can affect the brain. In the olden days, we had neurosyphilis, and then also TB, which is still common. Brain TB can cause dementias. Tapeworm infection of the brain. Many viruses like measles, which causes something called as subacute sclerosing panencephalitis. So children who suffered measles in the childhood, after a gap of 5 to 10 years, they could develop cognitive impairment along with seizures, and that can be a cause of dementia. In older people, something called as slow virus diseases, what causes CJD can be a cause of dementia, and also a few other infections like viral infections of the brain can cause dementia. So in a person, we should always think of infection, and usually brain scan and lumbar puncture, where we draw amount of CSF from the back and examine for virus, fungus, and bacteria and TB. We can diagnose most of the cases of dementias. Then not to forget depression. So people who are depressed or have severe psychiatric disturbances, they also have cognitive impairment. They don't mingle around much. They can have forgetfulness. So in our medical language, we call it pseudodementia. But the person with pseudodementia and dementia, they look almost similar. So we need to take good history and find out when the dementia symptoms started. Did the patient have features of stress, anxiety, and depression prior to that? And that can help us diagnose neurodementia. And as you can understand, if we treat underlying psychiatric disorders like depression, we expect good improvement in these patients. So, and the last part I want to highlight is something called as vascular dementia, where patients suffer multiple blood clots, what are called as infarcts. So when many parts of brain keep getting damaged with small clots or small infarcts, then that part of brain doesn't function properly. And this is more common in people who have risk factors like high blood pressure, high blood sugar, high cholesterol, obesity, sedentary lifestyle, and they may give history of paralytic attacks in the past. And that is called as vascular dementia. So again, with the help of history, the risk factors, and the brain scan, we can diagnose vascular dementia. And once we treat the underlying cause, we can expect improvement. So today's focus was mainly we looked at some of the common causes of reversible dementias and how they present, how we can diagnose. And treatment is very rewarding because unlike Alzheimer's disease, we expect good improvement after treatment. And I hope you learned something from this, and I'll be back with more videos in the future too. Have a good day.